Palmer, can you speak to some of the obstacles or barriers faced by healthcare providers themselves when treating myelofibrosis patients?
I think, one of the challenging pieces, I know in Arizona, we have a pretty big catchment area because there's not only the Phoenix metropolitan area, but there's a lot of small communities scattered throughout Arizona. And I think one of the issues that we have is, let's say I want to start somebody on a new medication that potentially has a side effect of anemia or something. Being able to manage them remotely is difficult because a lot of times they may require a blood transfusion. Can they even get a blood transfusion where they're at? How, can they afford the 5-hour drive down to Phoenix to get that? So I think sometimes, even access to simple things, well, I guess it's not that simple, but things like blood transfusions can be hard. Fortunately for labs, you're often able to get them most places through various, LabCorp Quest, et cetera. But sometimes any type of infusional treatment can be really, really hard to get.
Yeah. Thank you. Do you have anything to add, Dr. Rampal, with regard to barriers faced by providers?
No, I actually think that's a really important thing, right? Because it depends on, your area of the country and what access to resources patients have locally, right? If we're thinking about this as sort of a hub and spoke model, that may be the outdated model. In other words, it's not that people can afford to, from a financial perspective or a time perspective, come into, the major center and then go back. They need to get access to care locally, but you have to have, the infrastructure, the healthcare infrastructure, if you will, to deliver that care. And that's a difficult problem in many parts of the country.
Dr. Rampal, can you speak to unforeseen or maybe outdated practice-related barriers that may hinder your work and that of your colleagues with regard to myelofibrosis treatment?
Yeah, I guess my broad answer to this is that, things are changing rapidly and the pace of change is accelerated. In other words, when we think about myelofibrosis, the treatment paradigm probably, if you think about the last 15 years, in the early part of that, things were kind of relatively static, and now they're not. As new knowledge emerges, as new treatments emerge, and the challenge here, again, speaking in general terms, is, as Dr. Palmer pointed out, this is a rare disease. It's not something that's frequently seen by, physicians in the community. So how do you keep people up to date on something that is not the majority of what they do? It's a very small percentage of what they see and do. And that's an ongoing challenge, right? And I'm not sure there's any perfect solution to that except for education. It's just a question of how do you deliver that in a time-effective manner, so that people can devote some time to getting up to date. But it is ultimately a good problem that things are changing rapidly.
Absolutely. And Dr. Palmer, do you have any solutions or actions or things that healthcare providers can do as this treatment landscape rapidly evolves?
I think it's a real challenge because even when we look at sort of the dogma of like, well, what's the response criteria? I mean, when you're thinking of a lot of like solid tumors, you think, okay, did the tumor shrink a certain amount? Did the tumor go away? With myelofibrosis, when we think about even response criteria, it's really challenging. So I think, I agree, education is part of it, and it's trying to figure out how to distill down the really important components of how do you manage these patients day to day. We can talk about, the comfort study and the momentum study and everything else all we want to, that tested, were major studies that tested the drugs that we use, but then the nuances of how to manage them day to day is something that I think we could probably improve upon how we educate.